Good afternoon. In today's video demonstration, I will going to demonstrate the routine procedures of the clavicle, namely the AP projection of the clavicle and AP axial projection of the clavicle. Good afternoon, ma'am.
Afternoon, sir.
Please sit down po. By the way, ma'am, I am Jonah Pulgo Ikoy and I am your redhead for today. May I ask, ma'am, sa imong language preference?
Bisaya, sir.
Noted po, ma'am. Mungutan ako, ma'am, sa imong middle name, age, and date of birth, ma'am, para lang ni sa patient confirmatory, ma'am, if tama ba akong patient.
Pulgo, sir. Then 17 years old. August 3, 2003 po.
Noted po, ma'am. Mungutan po ko, ma'am, kung buntis ba ka karon?
Dili, sir.
Kada sa imong last ka gidugo, ma'am?
Last month lang po.
Ay, para sa unsa ganyan ni ma'am, sa unsa na part ang i-extrayhan, ma'am?
Sa akong left, dili, sir.
Sa imong clavicle.
Opo.
Naunsa din na, ma'am?
Nahulog po, sir. Yung mga naigo lang yung dili.
Then, maliw, sakit siya, ma'am.
Sakit-sakit, sir.
Pero makaya ran mo, ma'am.
Opo.
Sige. Before ta magkuhan sa itong procedure, ma'am, tagalo na to itong mga quintas, ma'am, or any metallic objects nga nasa imong liog or anything sa imong body. Then, naapod atong dressing room diri, ma'am, which is naay kuha dito, ma'am, atong patient gown, nakasangit sa atong hamper. Then, ang ano sa patient gown, ma'am, pagsuot is nasa likod ang paghikot.
Opo. So,
So, balik ko na ko, ma'am, ha, ang pagsuot sa patient gown, nasa likod ang paghikot.
Opo.
Then, mag-introduce ko sa imo, ha, ma'am. Kanidi ay, ma'am, ano siya ang gonadal shield. Then, sa gonadal shield, ma'am, tutang natin siya, diri, ma'am. Then, mo ni maprotekta sa imong ovaries, ma'am. Sige, noted po. Proceed na po ta sa dressing room, ma'am. Mag-change ka ang patient gown, ma'am.
Okay, sir.
Sean!
Assuming that our patient is naapa siya sa ato ang x-ray sa dressing room, nag-change yung patient gown, the technical factors for these procedures are the following. The 10 by 12 inches IR, then our lead marker, and the SID would be 40 inches or 102 centimeter. So, ma'am, ready na ba ka, ma'am?
Yes, sir.
Okay. So first, ma'am, ato to dali, ma'am. So the first position that projection that we were going to demonstrate is the AP projection of the clavicle. Assuming that our patient have already worn our patient gown, then in patient positioning, position the patient upright or supine. But in today's demonstration, I'm going to use the upright position of the patient. Then in part positioning, center the clavicle to center of the IR. So, ma'am, mag-touch ko, ma'am, ha. Then, in centering the clavicle, you must center it to the IR midway between the midline of the body and lateral border of the shoulder. Then turn the patient head away from the affected side. Ma'am, anak, ma'am, diriling, ma'am, ha. Then the affected side, by the way, is the left clavicle of the patient. Then, shield the gonads. So, assuming that the patient have shielded her gonads, then the central ray for this projection is perpendicular to the mid shaft of the clavicle. So the mid shaft of the clavicle is located. So this is the clavicle. So the mid shaft will be here. Then, if necessary, to decrease part IR distance and to improve the recorded detail obtained by PA of clavicle, place the patient facing grid using perpendicular central ray and position using above mentioned landmarks. So, ang landmarks kami. By the way, this procedure, we need to use a grid for this one to make to have an improved recorded detail. So, to demonstrate the central ray must be perpendicular to the mid shaft of the clavicle. So, from here, the clavicle is from here and here. So, dapat dito ang nakasenter yung central ray. And for collimation, adjust the collimation by 8 by 12 inches or 18 by 30 centimeter. Then place the side marker in the collimated exposure. So, assuming that, place the marker here. Assuming that we've already collimated we collimated it tightly, then instruct the patient to do not move. So the breathing for this one, or the respiration, is to suspend her breathing. Ma'am, inhale, exhale, inhale, then hold your breath, ma'am, then shoot. For the anatomy structure shown for AP clavicle projection, as you can see, we can clearly see the medial clavicle, the superior scapula, which is here, so a little bit shadow, then coracoid, the lateral clavicle here, and the acromion, and part of the humerus, the shoulder head, the greater tubercle, the lateral, the medial tubercle, the lesser tubercle, and so on. So for the criteria evaluation for this apiclavicle projection, the medial clavicular end lies next to the lateral edge of the vertebral column, as you can see here. Then the clavicle and superior scapular angle are visualized at the same transverse level, as you can see here. The clavicle is at the center of the exposure field. As you can see, this is the mid shaft of the clavicle. Clavicle and the acromion process are included within the exposure field, as you can see on the overall radiographic result of the radiograph. The next procedure that we're going to demonstrate is the AP axial of the clavicle. So in patient positioning, still the patient will be positioned in an upright position. Then part position is the same as with the AP of the clavicle projection. So center the clavicle at the IR, at the lower third of the IR, midway between the mid-sagittal plane and the lateral border of the shoulder. As you can see here, head away from the affected side if necessary. So ma'am, living ma'am. Then, shield the gonads. So, naka-shield na siya. Then, the central ray must be angled 15 to 30 degrees cephalad, centered to the mid shaft of the clavicle. So, to demonstrate our central ray, center the central ray angled between 15 to 30 degrees cephalad, centered to the mid shaft of the clavicle. So, this is the mid shaft of the clavicle. Then, for 15 to 30 degrees, so we'll be using 30 degrees. So, Hana. So, assuming that we've got, in collimation, adjust to 8 by 12 inches or 18 by 30 centimeter, then place the side marker in the collimated exposure field. So, assuming that we've collimated it tightly, and then instruct the patient to suspend his breathing. Ma'am, inhale, exhale, inhale, hold your breath, ma'am, then shoot. In the structure shown for AP axial clavicle projection, as you can see that the acromion, lateral clavicle, middle clavicle, the superior scapular angle, and the medial clavicle are clearly demonstrated in the radiograph. So assuming that this is the left part of the patient, no? So right man siya, so assuming left na siya, so the same lang gyapon sila og orientation. And then the criteria evaluation for AP axial clavicle projection, the medial clavicular end lies next to the lateral edge of the vertebral column. So as you can see here, no, the medial clavicle lies next to the lateral edge of the vertebral column. This is our vertebral column. Then the superior scapular angle is visualized 0.5 inch or 1.25 centimeter inferior to the clavicle. As you can see here, this is our superior scapular angle. Inferior of for about 0.5 inch or 1.25 centimeter inferior to the clavicle. Then, the medial end of the clavicle is superimposed over the first, second, or third rib. As you can see here, superimposition, there should be an superimposition of the first, second, or third rib. Then the middle and lateral third of the clavicle are seen superior to the acromion process, and the clavicle bows upwardly. As you can see here. The mid clavicle is at the center of the exposure field. As you can see, the clavicle and the acromion process are included within the exposure field. Ma'am, dahil na po itong procedure and salamat kayo sa pamino sa construction, ma'am. And by the way, ma'am, ang result ani ma'am is 2 to 3 hours pa po siya bago makuha. Okay lang ba, ma'am?
Okay lang, sir.
Sige po, ma'am. Thank you po, ma'am.
Thank you so